Hi, everyone. Welcome back. Today I have Dr. Peyton and Dr. Jill with me. They are Evlo instructors, former doctors of, well, they are doctors of physical therapy. They used to practice physical therapy. Now they work for Evlo full time. And we are here to answer some of your questions. So I put a question box on my Instagram and got some great questions that we want to address today. So we're just going to kind of tag team these. First question. Why ball crunches over regular crunches? So why put something behind your back instead of doing crunches from the floor?
Well, first off, there isn't anything wrong with doing crunches flat to the ground. So for some people, they might actually prefer that over a ball crunch, and that's great. But we prefer the ball crunch because it's going to increase the range of motion of the exercise. So instead of starting with your trunk neutral from the ground, the ball is going to prop you up from the ground. So now you're going to start with your trunk or your spine in a slightly extended position. So by increasing the range of motion, you're going to also be increasing the load to your abdominals. So it can be a way to ensure that you are going to approach muscle failure within that given time frame. So for Evlo, 60 seconds or less, or non-Evlo, 30 reps or less. So it can really increase the effectiveness of the exercise by increasing the range of motion.
Yeah, nailed it. I think when you're doing crunches on the floor, a lot of times it ends up being a lot more neck flexion, like neck movement, than it does spine movement. So a lot of people are stopped because of discomfort in their neck first, rather than the being limited by their abdominals.
Yeah, or they're sitting all the way up and feeling it in their hip flexor.
Yeah, and then it's more hip than trunk. Yeah, so the ball is really just... And there's nothing, I always say this in class, like there's nothing special about the ball. You can use a pillow, you can use a towel, like anything to prop your body off the floor. A Bosu ball, some people use, like it doesn't need to be a Pilates ball. It can be anything. Okay, question number 2. How accurate are body composition scales? I feel like I can speak to this one because I got one as an experiment, and I just talked about this in my, I did an update on 5 pounds of muscle, my updates, and I talked about this. I'll talk about it again here in case you missed that. But so I got a Hume body composition scale. It's Hume, and it measures different things. It measures like fat mass, muscle mass. I think it measures other things. And I wanted to compare that to the results that I got from my DEXA scan, which DEXA scans are more or less the gold standard to measure your body composition. And so I did my DEXA scan, and then right after I went home and did my Hume scale. And my Hume scale overestimated my muscle mass and underestimated my fat mass. So it was off on my body fat percentage and my muscle mass percentage. So it wasn't very accurate. And I think that that's pretty true across these scales. Is it's not necessarily always going to overestimate muscle and underestimate fat. It might be the opposite, but they're just not very accurate. But I do think, and I said this in an episode, if you don't have access to a DEXA scale and you want to see your trends over time, you could use it and just look at it more as trends and not pay attention to the absolute numbers so much. So you could do that. Or you could just look at like, am I getting stronger? Am I physically seeing more muscle definition? Things like that.
Yeah, I think that's probably almost the better way to go as opposed to relying on a smart scale is just if you don't have access to a DEXA scan or can't do a DEXA scan.
I agree because they're just not going to be very reliable. Right. It's not going to give you very good data.
Like kind of like a waste of
money. Yeah. I was like trying to give people alternatives and option. But yeah, just going into it full transparency, like it's just not going to be very reliable. So yeah, I would use those with caution.
Yep.
Okay. Number 3. This is about us as Evlo instructors. Do you film multiple classes a day? I wonder if you do more than the rest of us.
I love this question. I feel like it's so common in the fitness industry for influencers or even people who own platforms to batch film multiple classes all in one day, or they're filming stuff and then they're doing their own workouts separately, maybe not even ones that they're promoting on their pages or on their platforms. And that's one of the things that we are super passionate about here. And one of the things that I do think sets us apart, if we are not teaching for that day, we take the class that the other instructors are teaching that day later in the day. Or if we are teaching, that is our workout. You and Evlo members know, of course, you see us huffing and puffing and hear us huffing and puffing in classes. Like those are it. I'm certainly not doing another one that day. Of course, we do cardio on the side, like walks and steady state and things like that. But what you're seeing us teach is what we're doing, and then we're taking classes right along with you from the other instructors.
Yeah, and I think people like see us. We've all had our own journeys with building muscle and things like that, and we've all three of us have slowly built muscle over time. But it's taken time and consistency, like years, and like because it takes so much time, if we went and did extra things outside of the workouts, we'd probably hurt ourselves and it wouldn't be sustainable. Like, and we really rely on our bodies because we have to teach every single week. So if one of us is injured, like we can't afford that. So we can't afford to go overdo it and do more because we don't want to risk hurting ourselves. So
Great point.
Yep.
yeah. Okay, cool. Number 4. Is the workout just as effective if you have to stop halfway through and take the other half later? I actually think this is a really good question because I'm not sure the answer, so I think we could kind of discuss it. What do you guys think?
I feel like you could, because I feel like if you were to take like the first round of a class, so if you're working quads, biceps, abs, you do one hard set per muscle group. Well, the muscle and per each set is getting high stimulus. And then if you were to take a break, I don't know, let's say 4 hours later, you finish the rest, now your muscles are rested. So I guess in a way it could be kind of beneficial. And then you're just providing that high stimulus again. So I don't really see how it would be negatively affected if you did half and half.
My only thing with that is like, when would you have started the inflammation process by doing the first set, and that inflammation process that like accelerates over a matter of like 24 to 48 hours? Would that affect would you be interrupting that, by doing the workout again 4 hours later? That's my question. And this is like, truly, I don't think we have the answer. Like, I looked for research on this and I couldn't find it.
Yes.
So I think it's one of those things that it's like, if you need to do it,
Right. It's okay. And it could be like, maybe it does interrupt the process a bit, but maybe not to a big enough degree to really make
A significant
huge
difference.
That's how I feel about it. I'm like, if it allows you to stay consistent, like,
Yeah.
I think do it. I don't think it's a huge enough deal.
Yeah, it reminds me of the exercise snacks episode too. Just kind of piecing it together when you can, because I know there's different seasons of life where you're super busy, and if you've got a little bit of time in the morning and then a little bit of time in the evening, and you have that ability to commit to doing it that way, or that feels better for you systemically, then I think that would be better than not doing it at all. So
Yeah,
I don't think it would have a significant enough effect.
I agree. I've done that before, honestly, like where I'm like, I think I have my full time for my workout, like during my daughter's nap, and then she wakes up, and then I'm like, okay, maybe I could do this later, and maybe I get to it, maybe I don't. But
Right.
I think it's not more effective necessarily, but it is something that you could do if you need to.
Yes.
Okay, great. Good discussion. Number 5, thoughts on Evlo for men. Trying to get my husband to do it with me. I love this question.
I feel like you can speak to this the best
Yeah.
because you have a man who does Evlo.
My husband is like the biggest evangelist for Evlo, and it's so funny because he's so supportive, but he's not the type to like do something just to please me. Like he's like, if he didn't really like it, then he wouldn't do it. And he used to like lift heavy. He was an athlete. He played like golf and basketball and things like that. And he swears by it. He's like, I feel like it's a lot of principles of bodybuilding, right? So he like chest presses and whatever, and bicep curls and things like, and step ups, but he's like, I can do it and I don't hurt my back, which he has a like tricky low back. So the beauty of what we're doing is that it's not just specifically for females. Everybody has a bicep that bends their elbow. Everybody has a glute that extends their hip. So you can do the same exercises. It's just that men might need different weights than most women do. Like my husband chest presses a lot more than I do. And that's, as long as you're following those basic principles of getting close to failure, you can do the same exercises and train pretty similarly. I mean, dare I say the same?
The same, right?
The same,
Right.
if you're a man versus if you're a woman. Right. So absolutely, we tend to talk to women more because we are women, and one of our goals is to help women build muscle because I think there's just not that many solid resources for women out there. There's a lot more for men, but men can absolutely do it.
Yeah, love it.
Cool. Number 6, advice for low back hurting when doing heavy leg exercises. Love this question.
This is a good one. A couple things come to mind. So a few things that you can tweak about the exercises themselves. So if they're talking about Evolo exercises specifically, right? So we do a lot of single side stuff, a lot of single leg things. And if as you go up in weight, you're feeling more and more load through the low back in a negative way, because it's not bad to load your back. But if you're starting to have pain with it, it could be beneficial. We say this in class a lot, but we still get comments and questions about it a lot. So I think it's worth noting to place the weight on your thigh instead of having it free hanging by your side. That changes the load that you're getting to your low back. So when the weight is just hanging off to your side, let's say you're doing a lunge, you're going to have a lateral force through that lumbar spine. So your lumbar spine is going to be resisting a side bending force to the same side that you're holding that weight on. Again, not wrong or bad, but if that's something that you're feeling or noticing or experiencing it, just placing that weight on your thigh still gets great load to the glute, but removes that lateral force. So it makes it a lot more low back friendly.
I think too, one thing that I often do, because I have a history of low back pain, and it also, my back tends to be a little crankier during pregnancy because of the increase in laxity and hormones and things like that. So one thing that I'll do is I will keep the weight by my side on the way down, and then at the bottom of the range, I'll put it on my knee and then almost use that as a little assistance from the bottom range up halfway, and then I'll bring it back down. So I know that sounds like a lot, but it's just like a little slip. Like it's just like a little boop, bring it to the knee, bring it off and lift. So it's kind of, because sometimes like if I have the weight on my thigh the whole time, it just feels a little awkward. And it depends on your body proportions. Like if you have longer femurs, it's going to be a lot easier and more comfortable to do that. But I think that's a great tip.
And another thing we've seen, I feel like we've seen a lot more members doing lately, and we've mentioned this before in a Q&A with the three of us, but again, think it's worth noting here, is using a weighted vest for standing lower body exercises specifically. So it's not going to be directly even if you're putting on a 10-pound weighted vest, it's not adding 10 pounds specifically to the glute because you're wearing it as a vest, so those forces are going to be dissipated. However, it can absolutely increase the load that you're getting to the glutes, and some people are even using heavier than a 10-pound weighted vest. But I know a lot of longtime members have been posting about using that to increase without having to hold a 50 in one hand or whatever it is. So that's an option too.
I love that. I think also like if you are struggling with lunges, Bulgarians, step-ups, things like that, if those are the exercises, glider lunges, if those are the exercises that are bothering your back, just swap for ones that aren't. Like I know we say that all the time, but I can tell you again, I've been doing, when I take class, like lower body classes, I've been doing swapping for like a lot more hip thrusts these days, or the clamshell plus exercise that we've been doing, exercises that are a lot less load to the low back. So if you ever need to, you can just swap.
I feel like we've gotten that question a lot in comments in classes is, are the ground exercises truly a 1-for-1 swap for the standing? And so that's on the record. Yes.
Yeah. And it's a good question and a good discussion to have because if you're thinking about a hip thrust, a hip thrust loads the glutes in more of the shortened position, whereas in a lunge variation, it loads the glutes in more of a lengthened position. But if we look at the data, for example, a squat and a hip thrust build the same amount of muscle in the glutes. So, and a squat would be like a lunge, same as a lunge variation, right? Loading the glute from a lengthened position, whereas a hip thrust would be loading it from a shortened position. So, yeah, pretty much. Yeah.
Yeah.
It's a
Yeah.
1-for-1 swap. As long as you are taking that live close to failure, it's 1-for-1.
Yeah. And I do think it's important to make sure that there is a little bit of a caveat of, let's say, I don't necessarily think we would recommend doing the clamshell plus or hip abduction for every single movement, because you do still want to have that hip hinging motion. So making sure to incorporate some type of hip hinging, even if you're on the ground, like a hip thrust.
Yeah. Hip thrust, bridge. Yeah. Totally. Love it. Okay. Next, keeping gentle consistency with all the pressures that come with prepping for a wedding. Jill.
We look to Jill. We're past that phase over here.
Well, I'm in the very early stages of wedding planning, but I am going to be getting married in Tuscany in 2026. So I can imagine that planning a wedding overseas is going to be a lot of work. My sister got married in Italy last year, and she told me I should be scared. So, so here we go. But no, the good thing is I've been doing Evlo now for well over a year, like closer to 2 years, I think, at this point. So the gentle consistency mindset is pretty ingrained in me, which is great because now I've been doing consistently the 4 or 5 time Greek track. I kind of alternate between the two. And those are 35-minute classes. And so by consistently doing those, I've seen now, my firsthand, that I feel better than ever. I've definitely gained muscle mass, more confident, all of those things. So I know that I truly don't need to do anything extra during this time. It kind of takes that pressure away, that I can just keep doing what I'm doing. I don't need to overhaul what I'm doing or start, doing more intense workouts or longer workouts or adding a ton of cardio, whatever it is. So that is huge, that I can just, during this busy season, whether you're planning a wedding or whatever busy season you're in, you can know that you just, keep trucking along with this program and you're going to feel great. And because the classes are only 35 minutes, I surely scroll on my phone for at least 30 minutes a day. So if I have time for that, I have time to do a 35-minute class.
Yes.
So that's the thought process there. And then I've also been kind of just compartmentalizing things. So Monday through Friday, again, that's my time where I'm prioritizing my workouts, obviously work, cooking, fueling my body, chores, whatever it is. And then I work the wedding planning around that. So the weekends, I can wedding plan. Or in the evening after I've cooked and I have some downtime, maybe I'll do some research then. Or because we're working on Italy time, super early mornings.
Yes.
So just finding the pockets of time that works, but first prioritizing the things that I need to do to keep me feeling good, which in the end is probably going to help you with, de-stressing during this time that's super busy. And then, I know I'm more likely to work out in the morning, so I've been trying to get my workouts in the morning. So just finding those little things that are going to help you stay consistent, but definitely prioritizing that, and then wedding planning can come after.
Yeah. I feel like it's so cool watching you go through this, because when I was wedding planning, that was when I was in like the depths of my over-exercise phase of life. And I remember the month before, Peyton, I don't know how you felt. It'd be interesting because you were an Evelyn member when you got married, actually. But a month before my wedding, I was doing a ton of cardio, like not eating much. Like I think that is very common.
Very common.
So common.
Like 1 month before, or like a couple months before, as people are like, I gotta get a small gas bowl.
I would have for sure have had that
Mindset.
mindset.
Yeah.
Thank you. Mindset. If this was a few years ago. So I'm so grateful.
Yeah. And it just takes time. It just takes time. And I think, we always say there's nothing wrong with wanting to have an aesthetic goal as long as it's realistic and healthy. I think the problem becomes when people aren't implementing habits far in advance, and when they wait, like what I did,
Right.
kind of waiting until the last few months to really, really ramp it up. And then, it's not good for your mental health either, especially because 1 month before your wedding is insane, planning wise. So,
Or if the targeted programs that are very arm specific, I feel like that's really common right now on social media. Have y'all seen a lot of that? And it's do this specific arm routine for your wedding. and it's like daily doing the same things, which obviously we don't recommend. So I think those are pretty prevalent still too.
Good point. Yeah. Yeah. I mean, if you want strong arms, number one, you got to start earlier
Yes.
Right.
than like, a few weeks before. But two, like we wouldn't change anything, right? It's just like keep
Right.
working each muscle group 2 times a week on non-consecutive.
Right. That's why we don't have a wedding program. It's like
Right, yeah.
just the program. Just keep on keeping on. No, it's funny. I found Evlo right around when I got engaged, but not because I was looking for something for my wedding. So it was during 2020, it was during COVID. It was the very beginnings of Evlo. And I was just looking, I was used to bopping around to different in-person studios, and that just wasn't really an option at that point in time. So I was looking for something different and looking for something that I could feel really good with. And I was mainly looking for something for my patients. And so I was like, oh, I'll try it for myself and then see if it would be good as something for me to recommend to my patients. So I started it in July of 2020, and I got married, and that's when I got engaged, and I got married in May of 2021. So I had, 9 months of having Evlo in my back pocket and just doing Evlo consistently. But I can honestly say I didn't personally have an aesthetic goal. I am so much stronger now than I was then, like looking back on that times. But my goal was to just feel like myself and to feel really good. That was like a big goal of mine, was I don't want to look different than myself. And I just want to have the absolute best time of my life and best weekend ever. And it was. So it really did set me up for feeling really good. I just didn't think about anything at all. Like, especially in the months leading up to it, I was just continuing with my normal Evlo routine and carrying on.
Yeah, which is so funny because like when you picture that day, you wanted to just you picture the feeling. Like you want to feel really good. You want to be around all the people that you love. And like looking back, it's so funny, now that I can have hindsight, like nobody really cares that much about what you look like. And like,
or if they do, I don't want them at my wedding anyway.
Exactly. Like you will be glowing from the inside out if you're just yourself and if you're happy. But if you're like a shell of a person because you've broken down and you haven't eaten very much, and like, I guess you're probably like
Feel way worse.
you'll feel way worse. I know that's easier said than done because I do acknowledge that there are a lot of pressures
For sure.
and especially with social media.
Absolutely.
So I love it. Okay, last question. How to deal with body image postnatal? I think I could maybe do a separate episode about this specifically, but it's so funny. People tell you like, oh, you're going to drop all the weight like from breastfeeding. And that was not my experience. When I breastfed, I breastfed for 5 months. And then the last several months I was exclusively pumping. So it was like very difficult. It was very difficult. And so I stopped just because I was like, I can't do this anymore. I was trying to get to 6 months at least, but we got to 5. So I was proud of myself. But during that 5-month period, I was starving and I had a really hard time like regulating how much to eat, how much I should eat. I was just like a bottomless pit. I was just really, really hungry all the time from the breastfeeding hormones. And so I did not have the experience of like dropping all the weight immediately. Like, in fact, I think I might have gained a little bit of like fat maybe during that time. I don't really know. I didn't measure it. But I did notice my clothes were fitting a little tighter and things like that. However, it was just so interesting because during that time, if this had happened at a different point in my life, I think I would have felt much different. But during that time, I was like, yeah, like this is what should be happening right now. Like I just had a big life change. I'm not sleeping very well. I'm not able to exercise at full intensity because I'm still recovering. I'm not able to like, my nutrition isn't as dialed because like I just like had so much grace for myself, I think. And I also knew that it was a temporary season. And then I also had the evidence that like, okay, when and if I want to, get back to getting leaner or building more muscle, like I know I'm able to do that. I know what to do. I just had the confidence that I knew what to do and how to do it and that it's never permanent. So I think that was a really important realization for me during that time was that this is a phase. It's not permanent. And so I know that's like easier said than done, but I just had all this evidence leading up to that phase in my life. And so I just didn't put a lot of pressure on myself.
Yeah. I feel like you laid a lot of groundwork too during your pregnancy and did a lot of mental work around it during your pregnancy to set yourself up for success during that period as well.
Totally. Like, I'm not going to lie, pregnancy was, at first it was harder for me mentally, like seeing my body change and stuff. Just because it had never happened to me, obviously, that rapidly. And so,
and in that way.
yeah, in that way. And so it was a little bit of a shock. And so I had, I did a lot of mental work at that time. And then I really came around to this is the process. This is how it goes. This is the process. We're built for this. It's not permanent. And I just kept telling myself that. And ultimately I was like, okay, this is, my body is doing its thing. My body is providing. And at some point we'll get back to it if we want, but it doesn't need to be right now. So I don't know if that'll help anybody. But.
I think it
Sure
definitely will. I think it definitely will.
Okay. Thank you guys for being here.
Hey.
Thank you all for listening. We'll see you all next week. Same time, same place. Bye for now.